Hello and welcome. Today, we're diving into a condition that affects the stomach's ability to empty itself properly: gastroparesis. We'll explore what it is, what causes it, how it's diagnosed, and the ways it can be managed. This is an overview to provide a general understanding. Always consult with a medical professional for personalized medical advice. So, what causes this disruption in the stomach's natural rhythm? The etiology of gastroparesis is often complex and multifactorial. One of the most common causes is diabetes, both type 1 and type 2. High blood sugar levels over time can damage the vagus nerve, which controls the stomach muscles. Other potential causes include certain medications, such as opioids and some antidepressants, post-surgical complications, especially after stomach surgery, neurological disorders like Parkinson's disease and multiple sclerosis, autoimmune diseases such as lupus and scleroderma, viral infections that affect the digestive system, and even hypothyroidism. In some cases, the cause of gastroparesis remains unknown, and this is referred to as idiopathic gastroparesis. Let's understand what happens in the body when gastroparesis develops. The vagus nerve, as mentioned earlier, plays a crucial role in digestion. It signals the stomach muscles to contract and move food into the small intestine for further processing. When this nerve is damaged or dysfunctional, the stomach muscles either slow down significantly or stop working altogether. This slowed or halted gastric motility means food remains in the stomach for an extended period. The delayed emptying leads to a cascade of digestive problems and discomfort. Undigested food can harden into masses called bazores, which can cause nausea, vomiting, and even block the passage of food into the small intestine. Gastroparesis isn't a rare disease, but accurately determining its prevalence is challenging due to variations in diagnostic criteria and symptom recognition. It's estimated to affect millions of people worldwide. It's observed more often in women than in men. Individuals with diabetes have a significantly higher risk of developing gastroparesis compared to the general population. The age of onset varies, but it's often diagnosed in middle-aged individuals. However, gastroparesis can affect people of all ages, including children. The symptoms of gastroparesis can vary in severity and frequency. Common signs and symptoms include nausea, often persistent and debilitating, vomiting, sometimes of undigested food eaten hours earlier, a feeling of fullness after eating only a small amount of food, known as early satiety, abdominal bloating and discomfort, abdominal pain, which can be cramping or generalized, acid reflux or heartburn, poor appetite, and unintentional weight loss due to decreased food intake and nutrient absorption. The severity of these symptoms can fluctuate, making diagnosis challenging. Symptoms can be exacerbated by certain foods, stress, or other underlying conditions. Diagnosing gastroparesis involves a comprehensive evaluation to rule out other possible conditions and confirm the delayed gastric emptying. The diagnostic process typically begins with a thorough medical history and physical exam. A gastric emptying study is the gold standard for diagnosing gastroparesis. This test measures the rate at which food empties from the stomach. Other tests may include an upper endoscopy to visualize the stomach lining and rule out any structural abnormalities or obstructions. A barium swallow can assess the esophagus and stomach. Abdominal ultrasound can help rule out gallstones or other conditions. A gastric manometry test can assess the stomach muscles' electrical activity and contractions. Blood tests are also performed to rule out other conditions like thyroid disorders or electrolyte imbalances. Gastroparesis can be classified based on its underlying cause. As mentioned earlier, diabetic gastroparesis is a common type resulting from nerve damage caused by high blood sugar. Post-surgical gastroparesis occurs after surgery on the stomach or esophagus. Idiopathic gastroparesis refers to cases where the cause is unknown. Medication-induced gastroparesis is linked to certain medications that slow gastric emptying. Each type may require slightly different management strategies. The treatment and management of gastroparesis aim to relieve symptoms, improve gastric emptying, and maintain adequate nutrition. Dietary modifications are often the first line of treatment. This involves eating smaller, more frequent meals, avoiding high-fat foods, which slow gastric emptying, choosing soft or liquid foods that are easier to digest, staying well hydrated, and avoiding carbonated beverages and alcohol. Medications may include prokinetics, which help stimulate stomach muscle contractions and speed up gastric emptying, antiemetics to relieve nausea and vomiting, and pain medications to manage abdominal discomfort. In severe cases, more advanced treatments may be necessary, such as a feeding tube or a gastric electrical stimulation (GS) device, which uses mild electrical pulses to stimulate stomach muscle contractions. Managing underlying conditions, such as diabetes, is also crucial for controlling gastroparesis. While it may not be possible to completely prevent gastroparesis, there are steps you can take to reduce your risk, particularly if you have diabetes. Strict blood sugar control is essential for preventing nerve damage. Avoiding medications known to slow gastric emptying is important. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, can support overall digestive health. If you're undergoing stomach surgery, discuss the potential risk of gastroparesis with your surgeon. The prognosis for gastroparesis varies depending on the underlying cause, the severity of symptoms, and the individual's response to treatment. While gastroparesis can be a chronic condition, many people can effectively manage their symptoms with dietary changes, medications, and lifestyle adjustments. Research is ongoing to develop new and more effective treatments for gastroparesis. Some promising areas of research include new prokinetic medications, advanced gastric electrical stimulation devices, and minimally invasive surgical techniques. Further research into the underlying causes of idiopathic gastroparesis is also underway. Thanks for watching. Remember, this information is for general knowledge only and does not substitute professional medical advice.